All right, so I want to talk a little bit about another aspect of mental health, and it's exercise and prayer and how they can help mental health. So some of you, I noticed from your registration, some of you are church people who love God and who are active in your church, and some of you may not have that kind of community or support. So I want to talk about that a little bit, and I want to talk about exercise, and I want to talk about some really practical aspects of exercise as well, because I noticed that there's no one here under 20. Am I correct? Okay, all right, Sheila, yeah, 22 then. But one of the things that's challenging for a lot of my patients and in my own life is as I age and I start to run into some physical limitations, how do I overcome that? Because I know exercise is important, but sometimes it's less fun if it hurts, and sometimes it's harder to do because my safety concerns about slipping or falling are very different at 61 than they were when I was 16. So how do I mitigate those risks so that I can continue to exercise and do things that are healthy? So again, going back to what we had talked about before, input matters. So when we look to be mentally healthy, making sure that what we are surrounded by is healthy. Let me give you an example. When you're in a gym, you look around and what do you see? You see people pursuing their goals of fitness and health. You see people who are trying to be healthy. How about if you're in Dunkin' Donuts and you look around? Well, you're also going to see people, but you're going to see people pursuing different things, and they're going to look different, okay? Now, I'm not saying you shouldn't go to Dunkin' Donuts. I love Dunkin' Donuts, but input matters. So where we are, where we choose to be is important. Our brain, our environment, and our behavior all interact. So our brain is a wonderful and complex organ. It has chemical, electrical, and physical components to it. Our environment, sometimes we have control over. So for example, we can choose whether we're in the gym or at a workshop or in Dunkin' Donuts. We often get to make that choice, but we sometimes don't get to control our environment. So sometimes we are in situations we can't control. Our behavior, we talked a little bit about that before. In our brain, our thoughts, our patterns of thoughts are transmitted electrically and chemically. So we have what are called neurons, and those neurons are connected by synapses, and the synapses are the chemical component. So in the synapses, the thought can be triggered or modified by different chemicals that are released between the neurons, and those neurons transmit thoughts electrically. When we think something, there's a pathway that's created in our brain. Father Chris and I were talking a little bit last night about the liturgy, and for those of you who come from a Catholic or a Lutheran or an Anglican tradition, the liturgy is the prayers that we say together as a people. And it's interesting that if you go into the room of someone who has very, very advanced Alzheimer's and who comes from a liturgical background, very often if you say, "Our Father, who art in heaven, hallowed be thy name," very often they've said that so many times in their life that no matter what they're thinking or feeling at that point, they'll be able to go back into that thought. The thoughts, the words, the actions that we repeat over and over are our strongest pathways. That's why learning scriptures or memorizing something or crystallizing our intelligence by repeating something over and over is very helpful. That's also why exercise is helpful, because when we reproduce a physical activity, that helps recreate healthy pathways. It helps reactivate healthy pathways. That's why very often, if you're ever watching a show on physical rehab, and you'll see someone who can't walk, but the physical therapist will put them in like a harness, and they'll have them make those walking motions because that helps reconnect a pathway in the brain with those motions. So we create our own neuron pathways. So that's important in terms of what? Well, what are you going to choose to do over and over and over again? What are you going to say over and over and over again? What physical activity are you going to do over and over and over again? Does that make sense? Okay. Sometimes I get off on using too many medical words and I stop making sense. There's 3 neurotransmitters that are very, very effective in causing or not causing depression and anxiety. Serotonin, norepinephrine, and dopamine. And I promise you this will not be a biochemistry lecture. But it's important because you'll hear these words sometimes associated with medication or with exercise. So if you look on the right side of the screen, all of these are happy chemicals. All of these will help you feel better. So if you look at what exercise does to serotonin, what's it do? It increases it. How about norepinephrine? What's it do? Increases it. How about dopamine? What's it do? Increases it. Okay. Here's a picture of a modified PET scan. If you sit, that's what your brain on the left looks like. After a good walk, there's your brain on the right. Your brain gets activated. It stimulates the neural pathways. One of the really interesting things that we have found is that exercise is one of the things that's protective against Alzheimer's. So for me, no matter how much you hate to exercise, that's a big motivator, right? Now, I know plenty of people who were very physically active all their life and still got Alzheimer's. So it's not everything, but it's something. All right, let's talk about limitations, because this is what a lot of us face as we mature. If we've had an injury, if we've had a problem, if we've got a trick knee, what do we do? Well, first of all, let's set some realistic goals. So a realistic goal is 150 minutes a week. I didn't just pull this number out of the air, okay? This number is important for 2 reasons. One of them Kathy Radford knows, and that's because it helps prevent it prevents osteoporosis. Yeah, so Kathy has done the Bone Builders training, and she teaches for us for free a class every Wednesday and Friday between 2 and 3 p.m. And it's called Senior Strength, and it's exercises designed for people who have mechanical limitations. And so you can do many of the exercises actually seated. Some of them you can hang onto the chair. So it's something that's designed for people with physical limitations. The other person that you see up here is on the left is Ask Dr. Joe. She has YouTube postings like you would not believe. So I don't know if any of you have ever been on YouTube, but if you go on the internet and go to YouTube, see, this is the good side of screens. If you go on YouTube, Ask Dr. Joe. She's a physical therapist, and she has a posting on every part of your body that you can imagine. So if you have left elbow pain and you go to Ask Dr. Joe and put in elbow pain, she will have exercises for you. She has strengthening exercises and she has stretching exercises. And she always starts off with her little caveat saying, you know, this isn't like I'm examining you, so please don't sue me. But these are exercises that may be helpful. She has a wealth of exercises, particularly in the area of low back pain, including things that are very aggressive. So for people who are trying to build brick walls and you want to go back to your job as a bricklayer, that's probably not anybody here. But she also has exercise programs for people who may have mechanical limitations or may need to sit while they exercise. One of the things that's important about being a maturing athlete is to figure out another way to do it. I had a shoulder injury many years ago, and I loved weightlifting. That was my drug of choice. I loved weightlifting, and I hurt myself, and I could no longer do that. And I was very upset about that. So I went to my gym and I said, I need a trainer who can show me some way to exercise that's not weightlifting. And this little tiny woman came out and she brought a yoga ball. And I thought, oh boy, oh, this is gonna be like nothing. I'm gonna sit on a ball. I was sore after 20 minutes with that little tiny woman. I don't know how she did all those things. But that was great for me while I was recuperating from my injury. I stayed fit, I stayed toned, I realized I had more muscles than just in my shoulders and my legs, and it was a great way for me to work out. For me, exercise is really an important part of my mental health. If I miss my exercise, after 2 days I start noticing that I feel sad, I feel a little despondent, I feel a little bit more tired, I have less energy. So I recommend for most people, like Elizabeth is a really great exerciser. She does a great job. So if you want exercise tips, talk to Elizabeth or talk to Kathy, or you can talk to me too. But always be looking for something that you can do and make your goal 150 minutes a week. Different points in our life, we have different limitations, different needs. So if you have a job and you're very busy and it's hard for you to do this, some people do better with doing 50 minutes 3 times a week. I find I do better if I do smaller increments. So my goal is usually trying to exercise for 25 minutes every day. And that works with my schedule. And if it works with my schedule, it'll work with any schedule. I want to talk a little bit about prayer and mental health. For those of you who are current with this kind of thing, you'll see that Dr. Koenig looks much younger in this picture. So this is a very old picture. Dr. Harold Koenig has done some of the pivotal research on the relationship between religion and mental health. And a brief summary of it is that anybody who has any religion is probably going to do better than anyone who doesn't. Probably just because of the community factor. Because we all need community. You know, Susanna was talking about that. It's important to have community to stay well. We need to engage and we need to socialize. That's a human need. It's also a really practical need. If we have community, we have somebody we can pick up the phone and say, can you drive me to the airport? Can you help me with my groceries? And we do that for them too, right? We help each other. And the more successful we are at making a social network, the healthier we are. Well, there's more to it than that, though. On the right-hand side of that model, we have the ACTS prayer model. Has anybody ever seen that before? Yeah. So ACTS is a very simple way of praying, and it starts off with focusing on God, ACTS, adoration. The second part is confession. So if we've done something wrong, confessing to God, perhaps confessing to another person. Thanksgiving, being grateful for what we have and asking for what we need. One of the things that I think is really helpful, I'm a Christian, one of the things that I think has been very helpful for me in my own mental health journey is being able to look at God instead of at me. Because when I look at me, I see someone who is imperfect. I see someone who has faults. I see someone who is driven by things that perhaps I shouldn't be. When I look at God, I look at someone who's perfect and loving and patient and kind. And I'm also looking at someone who can give me hope in my circumstances. One of the most important things we can have is retaining hope. When we go through situations, if we find we're in a situation that is painful and difficult, most of us are willing to endure that if we have hope that it will get better, or if we feel that it is positive in some way. Let me give you an example. If someone has cancer and they go through chemotherapy, they will go through chemotherapy with the hope that they will get better. People will endure terrible, terrible things. They'll endure all kinds of pain from surgery or from chemotherapy with that hope that they will get better. And they won't like it, but they'll endure it and they'll be able to see the positive in it. Because they'll say, okay, I'm taking this, it's gonna make me feel sick for a little bit, but I know it's gonna help me. If we go through a situation and we feel hopeless, if we feel like it's not going to get better, if we feel like our suffering has no purpose, that's when we tend to become despondent. Psychologists have done a lot of studies on animals, and I don't know if you've ever heard of this study, but there was a study where they had, it's kind of a mean study, but they had a dog, and there were two sections of the room. And both sections of the room would be, the dog would get a little shock. And in one set of the circumstances, it was randomized, so the dog didn't know when the dog was going to get the shock, and there was no warning. The other section of the study, the dog would have like a little warning or a little treat. If he went to the other side of the room, he wouldn't get the shock, and if he stayed on that side of the room when he heard the sound, then he would get the shock. The dogs that didn't have any control, that couldn't do anything to avoid the shock, after a while they just laid down and became depressed. Dogs that could avoid the shock, they could change their circumstances, did just fine. They adapted, they coped. And that's true for us too. If we feel we have some measure of control, then we will do better. And that's what we have with prayer. That's what we have in our relationship with God, is we can go to God and we can say, Lord, I know this disease I have is incurable, or this circumstance that I'm in is unfixable, but I know that you can be with me in it. I know that you can help me in it. I know you can help me with my attitude. I know that you're the God of the impossible. And even though no one else can fix it, you can. So that's why I think looking at God instead of looking at me is really helpful to me. So acts, adoration is the first part, looking at God. Confession is the second part. If we confess our sins, he is faithful and just and will forgive our sins and purify us from all unrighteousness. Did my husband talk about the Italian mental health study in his talk? So there was a study in Italy on mental health in, I forget what year it was, I think it was in the 1960s. In the Italian Catholic Church, it was mandatory that before you received communion that you make a confession. And that requirement was dropped somewhere in the 1960s. And, of course, in Italy, a very large segment of the population is Roman Catholic. And one of the things that they noticed is after that requirement was dropped, the number of mental health crises increased. Why is that? Well, because when we do bad, we feel bad. And if we don't have a mechanism for getting that off our chest, whether it's going to God and saying, I'm sorry, or going to another person and saying, I'm sorry I hurt your feelings, or I'm sorry I did this. If we don't get that resolved, we just put it away in the back of our mind. But what we're putting in the way at the back of our mind is, I'm not a very good person. I don't do everything I should. And so we carry that. We don't resolve it. One of the things that's very important in psychology is we can't fix everything, but we can often come to a place of acceptance with it. We can resolve it. So we have certain things that happen in our lives, like we lose someone. Well, remember all the elements of loss, right? Grief, anger, unsettledness, and acceptance. So when we come to the place where we accept it, we kind of go that closed circle, it becomes part of our life. So confession helps us resolve those things that we feel we've done wrong. Thanksgiving, gratitude attitude. We are all much happier people when we focus on the 99 light bulbs that are burning and not the one that's out. Supplication, asking God for help wherever we need it. And there's this wonderful promise in Scripture: for everyone who asks receives, and he who seeks finds, and to him who knocks it will be open. That's a wonderful promise to hang on to. So I just want to say in summary, first of all, thank you all for coming to Mental Health Morning. And I just want to say there's many, many ways to improve mental health. Sometimes we can become discouraged or frustrated. There's so many things that we didn't have a chance to touch on today, but we can all exercise. We can all look at our diet. We can all pray. Medication can be very, very helpful for some people. It's not the right answer for everyone. Counseling can be helpful. Changing our thoughts, specialized interventions like accelerated recovery therapy, transmagnetic cranial stimulation, and the help of others. So don't give up. Keep pursuing mental health, and thank you for coming. If any of you would like to ask questions, we have a few minutes for questions now, and there's a book table in the back if you would like to purchase any books. So anybody have any questions? Yes.
Yes, which one is Elizabeth?
Elizabeth, would you raise your hand?
Oh, okay. Thank you.
All right. Any other questions? All right. Well, thank you for coming. It was wonderful to meet you all.